We're here for, I think, a great occasion. I'm going to actually not spend any time with you right now. I'm going to come back and make a few comments in a second, but I want to kick things off by thanking you all for being here, and then I'm going to ask David Dunn to come up and make a few opening comments. David?
Well, good morning. Thank you very much, Craig. You know, it was just a really short time ago that we launched the Office of Public Health Practice here. And one of the primary goals was for our School of Public Health and Information Sciences, led by Dean Craig Blakely, and his colleagues to get out into the community and do what public health schools do in the 21st century. And that's not just study epidemiology, it's actually public health practice trying to change the geography, if you will, of the landscape of social determinism of disease, among other things. And we're very proud that this grant has been awarded to Dr. Monica Wendell and her colleagues from the Centers for Disease Control. The CDC has been active in public health for years and years and years. That's one of the reasons it exists. But what is not known is that they don't just fund epidemiologic studies. They're not just worried about Ebola and things that are of great significance in the world we live in today. But in this particular case, they're interested in how we can prevent social violence. And in this case, young men and women who live in a relatively underserved area, and compare them through our work of our colleagues at Vanderbilt University to others who perhaps have better means. Penetrating and blunt trauma are the leading cause of death in many underserved areas, including the West End, for individuals in the 10 to 24 to 25 year age group. It's something that we all know exists, but it isn't just gun control, which I think is exceedingly important, but it's really dealing with the individuals in the social setting. And so this $5.7 million grant from the CDC is, to me, an amazing grant. It will be a way that we have a platform for making things better in the West End and other areas. It probably will lead to many more grant extensions because I think this work is going to be very effective as I understand it. So the University of Louisville Health Science Center, the University of Louisville are very proud to have these practitioners of public health working on this, and we're very, very happy to have received this grant. Thank you.
Actually, David was one of the folks that aggressively recruited me here a little over 2 years ago. And one of the first people I met when I got here was our Vice President for Community Engagement, Dan Hall. And Dan, in fact, quickly introduced me to Sam and Kevin here at LCCC. Kevin, I heard you were here somewhere. Where's Kevin? There's Kevin. Okay. Sam, I hear, is out of town. But that partnership is really important to us, and so we were really pleased being here. So let me now turn it over to Dan to make a few comments on behalf of the university as well.
Thank you, Dean Blakey. As you know, in 2007, UofL President Jim Ramsey announced the launch of the Signature Partnership Initiative with West Louisville. The goal of the Signature Partnership Initiative is to work with community partners and community residents to enhance the quality of life in West Louisville by focusing primarily on educational attainment. At the heart of the Signature Partnership is our work with students, teachers, and parents in designated schools in West Louisville. But we understand that in order to improve educational achievement, we must also work with community to address other issues that oftentimes serve as barriers to real learning. Many of these issues are associated with poverty, which produces health, economic, and social disparities. This is why University of Louisville students and faculty from various academic disciplines are working closely with community organizations and community partners like LCC and community residents to address these complicated issues. Last year, UofL was engaged in over 100 partnerships in West Louisville. Over 3,400 students, 380 faculty, and 660 staff were involved in a range of activities, including community-based learning, service learning, research, or volunteer activities that focus on this community. This work not only helps our community, but it also enriches the learning experience of our students. Every school and college at the University of Louisville is an active participant in the Signature Partnership. The School of Public Health and Information Sciences, under the outstanding leadership of Dean Blakely and his wonderful faculty, staff, and students, has been a real leader in this effort, as evidenced by the location of their Office of Public Health Practice in this beautiful facility. The grant award being announced today will help address a critical challenge that this community faces and communities all over our country are facing. We are hopeful that this center will become a valuable resource along with our other collective efforts to make our community a more vibrant and safe place to live and to raise families. So congratulations, Vice President Dunn, Dean Blakey, and Dr. Wendell, and your staff, and our community partners for all the work that you do and for helping to make this possible. Thank you.
You know, one of the things that I always struggle with is sticking to the script, and I can feel Gary and Melissa and Julie glaring at me right now. I'm going to do that in general, but I'm going to make a couple of quick comments right here. I'm inclined to introduce Monica next because I know that the mayor does his homework and he's going to come up here and take 18 of her 20 points. One of the things that also was encouraging to me when I was contemplating moving to Louisville was looking at the interface between the university and the community. And that began with the Signature Partnership and the clear work that the university was already doing in the community. But it also was clearly influenced by the position, the posture of the mayor and his team as well, and the health and all policies kind of perspective. And I've talked to a lot of public health folks around the country, and most of them are jealous about that perspective being in place here. That's just unheard of in most cities. So I'd like to now invite the mayor to come up and make his 18 comments.
Thank you, Dean. Hey, before I start, I'd like to introduce a few folks here, so if you don't know them, you can connect with them later and do some more good work around what's happening here. First, Yvette Gentry is here. So Yvette is in charge of our community building for the city of Louisville. So our Office for Safe and Healthy Neighborhoods reports into her. So it's going to be a big partner in the work that we do here as well. Dr. Moyer is our interim director for public health. And then our newest employee, Brandy Pryor, right here, just moved to town. She's in charge of our Center for Health Equity. So let's give our newcomer a happy to have you. So these folks are making it happen. Please get with them. Carolyn Tandy is here representing Congressman Yarmouth's office. So thank you for being here as well. We've got a great congressman here. And then Dan Crutcher, I want to say thank you as the chair here for hosting us once again. It's great to see everything happening at LCC. So good job to everybody. Well, we're really excited about this because I think you all know we've had a lot of work going on in this area, and I want to thank Dr. Wendell. I was saying this is not an insignificant amount of money we're getting here with this grant. A lot of good work can be done over these next several years. So from Dr. Wendell, Dean Blakely, President Ramsey, Dr. Dunn, this is just another one of the partnerships that we have. And as we all know, any great city has got a strong partnership with its key universities. So we're really thankful for that, thankful to the CDC for believing in this project and seeing the potential to, with UofL's Youth Violence Prevention Center, to help break the cycle of violence that is, unfortunately, in all American cities right now. That's driven by hopelessness and disconnectedness. And there's not just one tool that we have to help turn this around, but this will be another very significant tool in our toolbox to kind of stop what we see with too many kids, where they see violence as the only way to resolve issues. And we've got to continue to work on this. And a lot of this work, we're not going to see results tomorrow, but this is work that's too important. We're not going to give up on it. We know some of the seeds that we're planting today we may not see for years to come, but we're going to keep doing this work. I think I can speak for all of us here when I say it's unacceptable to have neighborhoods in our city where violence is seen as a normal part of life, and in cities as well. So, you know, think about what's happened to many folks over the years. You know, you're reading the newspaper, might be on page B3 now, you know, and say, you know, youth gunned down in fill in the blank. Do you stop and say, you know, what's happening to our society, what's happening in our city, or do you just turn the page and go on? You know, if we get to the point in our community where you say, you know, that's just normal, that's just the way it is, doesn't affect me, you know, that's some time for some serious, serious soul searching. Because these acts of violence are not normal. We know that. You know, kids, when they're born, what they want is a hug and a kiss. You know, they don't go up and start slapping somebody on the face. So we have to return people to that kind of original state where they want to do something with their lives. We do a lot of work in this area, and I say, if I can't get you on the moral standpoint, start thinking ahead of what kind of city do we need to be to compete in the 21st century. We've got to have each and every one of our citizens ready to compete and contribute both on an economic standpoint and a civic standpoint at the same time. And that means that people have got to see disagreements as opportunities for dialogue, opportunities for coming together, as opposed to an opportunity for violence. That obviously is a public health problem. That's why we've also approached violence reduction from a public health lens. It basically comes down to people's ability not to cope. You know, we don't have the social and emotional coping skills, so what they do is go from, you know, problem to violence, as opposed to problem, let's think about this, how do we cope, let's work it out so we can both move forward into the future. So we couldn't be happier about this. The UofL Youth Violence Prevention Center is a tremendous ally for our Office for Safe and Healthy Neighborhoods, which oversees quite a few programs designed to help citizens reduce violence and address areas of need. Programs like One Love Louisville, Be the One to Make a Difference, where we're attacking reduction in homicides, suicides, overdoses. We encourage every citizen, you know, you be the one to make a difference. Because this kind of work, there's plenty of moments of truth where you can either engage and save someone and lift them up, or you can just kind of walk away because it's convenient for you and you haven't welled up the courage to do that job. Programs like Right Turn and Reimage. Aubrey Williams is here today. Aubrey's one of our mentors in the Right Turn program. These programs, Right Turn and Reimage, in partnership with Kentuckiana Works, we work with young people who've had some kind of encounter with the justice system and work with them to change their path through mentors, through helping them finish their GED, get them a job, show them there is another way other than the way of the streets. When we think about how our young folks are looking at us, what are we doing? Establishing the UofL Youth Violence Prevention Research Center was a big signal to our young folks that each and every person in our community counts, and we're doing something about it. We want the potential of each and every one of our citizens thriving and flourishing. That's how we define compassion here in our city. It's an action word. What are you doing to help everybody's potential to thrive? So we're very excited about this being another arrow in our quiver for a safe and healthy city. I look forward to the results of this partnership between Vanderbilt, my alma mater, the U of L, the CDC, and the Office for Safe and Healthy Neighborhoods, and of course the Youth Voices Against Violence. I think this initiative is going to have a tremendous impact in the lives of our citizens, and I look forward to the results we have here so we can share them with the rest of the country as well. So congratulations to all involved for this very important work. Thank you.
Well, following the mayor's lead, I should introduce Jill Bell, who's our board chair. Thanks for coming today, Jill. All right. Could I get everybody that's aligned with the School of Public Health just to raise your hand real quick? I'm not going to introduce everybody. But I want the mayor to notice that Brandy raised her hand. She's actually a shared position, so which is, I think, really indicative of the kind of partnership that we're building here. Now, I get to introduce Monica now, and I could go on and on about that, but I'm just going to say a few things. First of all, the week that I came and interviewed here, I already started thinking about how I was going to, I knew her in Texas, and I already was thinking about bringing her here. And I know when I spoke to David Dunn the very first time on my first interview here, I mentioned that there was a trailing hire that was actually essential to the plans I had for building this partnership with the public health school in the community. Monica didn't quite know that yet, but the plans were already in the works. And rather than steal any more time, let her talk, I just want to point out that I feel really good about being a recovering Texan, and I'll let her make her own comment about that. Monica Wendell, this is your day.
Thank you. It's a big day. My youngest son, who was born in Haiti, was recently told by a kid at school, black people can't go to school here. Dielo's 6. My 8-year-old son, earlier this year, heard from a kid in his after-school program, it's 1952, and you can't sit at this table. You have to sit somewhere else. And as much as that infuriates me, I know that African American youth hear much worse things every day. Even though I'm only half white, I benefit from white privilege. My husband benefits from white privilege. My oldest son, my daughter benefit from white privilege. I acknowledge that. I didn't ask for it, but I recognize it. For some people, acknowledging that is uncomfortable. And for some people, being asked to acknowledge that is the equivalent to being accused. The fact that discrimination exists doesn't make us all guilty. But the fact that discrimination persists might. If we're too comfortable with the way things are, if we're not uncomfortable enough to look at it, to talk about it, and to do something about it, then we're complicit in the way the system is. My older two will benefit from white privilege, and my younger two are going to suffer because of it. There's young people all over our country who are angry. They might not be able to articulate it, but violence, the kind of violence that we're talking about, is a symptom of that anger. And that anger is a symptom of something much deeper. The reality is that a history of discrimination and bias has created a system that disadvantages African Americans. The system is so complex and so well structured that it's easy not to see it. And it's easier to not see it. There's conversations happening on college campuses across the country right now. In fact, on UofL's campus, literally right now, about these kinds of issues. We need to engage. We need to be open to conversations that might be uncomfortable, about history and about the future. We can't change what happened in the past, but we can look at it carefully. We can sit with the discomfort of it, and we can use that to let us change what happens in the future. Many African American youth are traumatized by discrimination and then re-traumatized by a system that tells them that it's just them, that what they have experienced isn't really what they think it is. They witness and they experience violence in many forms, and in many cases, how they feel personally about violence doesn't really matter, because sometimes engaging in violence is just about survival or about belonging in a community. Our young people are surrounded by messages. Not all the messages are overt, and they're not all explicit, but they're all heard, and they're all understood. Messages about where they came from, about who they are, about what they're worth, and about how society thinks they're going to end up. This is magnified by disproportionate images and stories of African American youth and adults as perpetrators of violence and crime in the media, to the point that we actually believe that people with black and brown skin are more likely to be violent or commit crime, which isn't the case. What my team has heard repeatedly over the past 18 months from youth in West Louisville is that they're not being taught their true history. A young girl looked me square in the face and said, if we only understood where we really came from, that we didn't start here as slaves, we were started as kings and queens, we would have a much different perception of who we are and who we can be. So how do we tap into that? Different disciplines have tried a lot of strategies to reduce youth violence. Public health has tried it. Psychology, sociology, communication, social work, youth development, criminal justice, education. We've all tried to tackle it the ways that we know how. And what the outcomes tell us is that we can make differences in the lives of some kids who participate in specific programs if they get enough dosage of the program under the right circumstances. But we're not making a dent at the population level. So today marks a day that we're going to try something different. This CDC grant and the establishment of the Youth Violence Prevention Research Center here at UofL is going to bring multiple disciplines to the table with young people to change the narrative. I believe, I heard from Theo Edmonds this morning, and we're trying to verify, this is the first time artists have ever been brought in to this kind of research that's funded by CDC, and we're excited about that. We will bring young people to the table to figure it out. We've got partners who have bravely said, let's link arms and figure out what works. These people are willing to have hard conversations, to stretch their expertise and their science to the edges of what we know, and to do something that hasn't been tried before. Our team in the Office of Public Health Practice, who I'm going to introduce up here, Monique Ingram, our program director, Trinidad Jackson, one of our senior research associates, Ryan Combs, who couldn't be here, Nita Ali, who was here in the back, but I know she had a focus group this morning, Billy Castle, and Gabe Jones. And also I want to acknowledge our colleagues that are in the room, who I'm so glad for you guys to be here. Drs. Mari Nation and Paul Spear from Vanderbilt University, our collaborators. Dr. Stuart Esrock from the Department of Communication at UofL. Dr. Kate Fossel from the Ann Braden Institute for Social Justice Research. Our partners from the Mayor's Office of Safe and Healthy Neighborhoods. I saw Quiniqua walk in somewhere. Louisville Metro Public Health and Wellness, Dr. Moyer, the Center for Health Equity. Brandy, I'm thrilled to have you here. Brandy and I go way back. Louisville Metro Police Department, Jefferson County Public Schools, Ideas X Lab, our artist collaborators, Kentucky One Health, Alice and Annabelle, and Renaissance Creative, who is going to help us figure out how to actually make all of this stuff work. We'll be working for the next 18 months with youth from West Louisville to develop a multimedia campaign aimed at raising the consciousness of youth about their history, about things they have to be proud of, about people of color who have made extraordinary contributions to humanity, and tying that to positive racial and ethnic identity, and tying that to the narratives that shape behavior. Once the campaign is designed, a whole host of community partners have committed to helping us deploy it through various forms of media and through their community events, and helping us connect youth to available resources and services. Specifically, we'll be partnering with the Interdenominational Ministerial Coalition, Kentucky In a Works Youth Career Center, Kentucky YMCA Youth Services and YMCA of Greater Louisville, Louisville Central Community Centers, the Louisville Urban League, Louisville Metro Juvenile Detention Services, the Muhammad Ali Center and the Muhammad Ali Institute for Peace and Justice, the Peace Education Program, Restorative Justice, and the Center for Women and Families. That represents a small fraction of organizations in this community who get that now is the right time to be addressing this. This dialogue is emerging. It's emerging locally, it's emerging nationally, it's emerging globally, and we have the opportunity to be part of it. And that tells me that we can change the narrative. I heard a colleague once asked how many children he had, and he said, I don't know. How many are there? I think we all need a little bit more of that perspective. The state of our community not the part that we call our community, but the state of our whole community, is all of our responsibility. Whether we recognize it or not, we're all connected, and what happens to us is all connected. I can't think of people that I would rather work with to try to make our community better for everyone. Like Craig said, I think that we have colleagues all over the country who are trying to do similar work that are jealous of the amount of local support through the government, through the university, through community partners locally to tackle these issues. So thank you for being here today, and we look forward to cultivating a narrative of hope with our young people in West Louisville.
Well, so as you've heard from that description, it's going to be a fairly complex project with lots of different people engaged, which makes it even that much more complex. But that's the nature of what's got to come together in order to really make a difference. And so we're really excited about the entire team that's going to make this happen. That kind of concludes our structured presentation. We want to open the floor to a few questions or comments, and you can either direct them at anybody up here or make a generic comment or question, and we'll respond as we're inclined. Okay? Anybody? Yeah, Yvette, you must have a question. Okay. All right, there's a comment. There's the first comment. We're happy. Everybody's happy. All right. We'll do that in just a couple minutes. Yep. Any other questions? We don't need to do questions. We're happy to do one-on-ones with the media as well as with individuals. Going once? Going twice? Okay, thank you everybody for coming, and we'll go ahead and do that.